order. And we will kind of go in the order of our agenda, starting with the appearance by Dr. Jennifer O'Brien. Before just as a matter of housekeeping, do we need to acknowledge Paul's presence on Zoom?
Yeah, I guess.
Yes, just for clarification. So our board attorney is present, but is joining us today via Zoom.
Yeah. Hi, can you hear me?
Yes, we can. Thank you very much.
I'm sorry. I'd really rather be there than have COVID.
Well, we're glad that since you have COVID that you're there.
Yeah, I understand.
All right. So, Dr. O'Brien?
Yes, hello. Thank you very much for letting me address the executive committee. I am requesting a waiver of the 7-year rule for the USMLE exams. I completed an MD PhD program that was rather lengthy, that contributed largely to the extension of the time. I am currently an active clinical pathologist. In my fields are transfusion medicine and hematopathology, primarily transfusion medicine. I participated in an MD PhD program at the University of Texas in Houston. I entered the MD PhD program in 1994. The MD PhD program at UT Houston was unique at the time, that the program required you to do your first 3 years of medical school, and then do your PhD, rather than the first 2 years of medical school and then do the PhD. In order for me to be able to progress on to the 3rd year, the USMLE Step 1 exam was required at the completion of the 2nd year before I entered the 3rd year. The 3rd year of medical school was completed. It was valuable for me because it did influence my selection of the research programs that I chose. My field of specialty interest was neuroscience, and that's where I got my PhD. One of the things that happened during my 3rd year, the PhD mentor that I had selected for myself based upon my research tutorials left the institution. And so I had to quickly find a new mentor. I did choose a laboratory that I was familiar with, but it was not my primary interest. I was in the laboratory of Dr. David Marshak for about 2 years, but chose to change projects, change mentors, since I had the opportunity to pursue something that was more of my interest. I entered the laboratory of Dr. Stephen Massey, who became my final PhD advisor. In his laboratory, I did have to build a molecular biology laboratory and develop a project from scratch. The project began to produce results, at which point the tropical storm Allison hit the medical center. The tropical storm Allison did result in the death of several research animals and the loss of several research supplies, such that I had to begin again after the tropical storm Allison. The projects then began to produce results, and in 2006, my committee allowed me to write my dissertation for my PhD, and then, but they did require that I complete my PhD before returning to my 4th year of medical school. I returned to my 4th year of medical school and graduated in 2007. So from 1994, when I entered, to 2000, and in 1996, when I took my USMLE Step 1 exam, to 2007, that was 13 years in medical school, 11 years from the time of taking the step 1 exam. I completed the step 2 exam in 2008. And then I entered a very small but very active pathology program at Tufts Medical Center in Boston. Since there was only 3 residents for our year, we had a lot of service time with very little time to pursue academic pursuits and studying for exams. As a result, I was not able to take my step 3 exams until after I had finished my training in pathology. I did have some other issues of maternity issues during that time period as well. I completed my step 3 exam when I was able to enter my fellowship program at Washington University in St. Louis. During my fellowship, I was able to take and pass the step 3 exam. After that, I completed the fellowships in transfusion medicine and hematopathology. I took my anatomic and clinical pathology boards after I finished my transfusion fellowship, and I was able to pass that in sequence. I took the clinical pathology portion and then the anatomic pathology portion. And so after that, I then took the transfusion medicine boards and the following year, the hematopathology boards. I've maintained an active license since 2013. I'm currently licensed in Missouri, Louisiana, Florida, and Maryland, and I would like to get a license in Mississippi. I'm now serving as the section head for transfusion medicine at Osher Medical Center. Previous academic appointments included I was on faculty at University of Maryland from 2015 to 2018 as an assistant professor in transfusion medicine and hematopathology for Department of Pathology. And then from 2018 to 2023, I was again, assistant professor at Mayo Clinic in Florida and the director of the blood bank at Mayo Clinic, Florida. And just recently, I accepted a position as section head or director of transfusion medicine at Osher Medical Center in New Orleans. Osher does have a few sites that they receive specimens from in Mississippi and may provide guidance to the on-site pathologists with regards to transfusion medicine and apheresis. And that is why I'm pursuing the medical license for Mississippi. I have several publications, which I believe are with the CV that was submitted previously with part of my application.
So does that, I didn't want to interrupt you. Sometimes we'll speak over each other. Did that conclude your presentation?
That's the primary portion of my presentation, yes. I'm available to answer questions.
Okay. So thank you for that. I guess my first question is just, so I understand that you had quite an extensive process in trying to congratulations on sticking with that PhD. It can be very intimidating for those of us who dedicate our lives to medicine, especially anticipating the long period of time associated with training alone to take on the PhD. And I think for a lot of people, they are somewhat disincentivized by the fact that there's a little bit of uncertainty that goes along with that. So congratulations for sticking with it. My question is, in the subsequent examinations that you have taken, have all of those been successful passes on your initial attempts?
The I took the USMLE Step 2 early after my third year, before I had completed all of medical school, because of the fact that I knew I was going to start the PhD program. I had failed that test by about 5 points. And so that's why when I did retake that exam in 2008, when I was able to actually spend time and dedicate to studying. The APCP exam, I passed the clinical pathology portion, and then did retake the anatomic portion at the next cycle. That's something that is very commonly done for the anatomic and clinical pathology exam, because both exams require extensive knowledge. And it is very commonly done for the APCP programs. So that is what I did, and I passed, completed the pass of the anatomic and clinical pathology in the 2 separate sittings, in clinical pathology first, anatomic second, in November of 2014.
So your initial, and I'm just trying to get the timeline,
Sure.
because so for your initial USMLE Step 2 attempt
Mhm.
was at the conclusion of your third
My
year.
third year. Yeah, before I had had neurology rotations, before I had I did, in my fourth year, I did neurology, pathology, ophthalmology, and basically sub-Is of all the primary medicine programs for my fourth year. The So I attempted USMLE Step 2 in that summer of 97. I think I failed it by 5 points, but again, I had not completed medical school at that time. And there were several things that were missing from my education at that time. And then I attempted it, I took it a second time in 2008 after I graduated from the medical school, and had the time of that year to finish up PhD activities and dedicate some time to studying for that STEP exam. I did have some exam phobia, because the failure of that STEP exam was the first time I'd ever failed exam. So
And was passing, so was the completion of Step 2 a prerequisite for conferring your degree for medical school?
no, passing Step 2 was not a requirement for the conferring of the degree from medical school. The taking of the exam was a requirement, but not the passing.
Okay.
Go ahead.
No, I just was going to see if that you can complete your answer if you wanted to add some more to that.
No, I was fine.
Okay. So I just wanted to see if any other members have any.
So when did you pass the Step 3?
So the Step 3, I was able to take time to study for it when I was out in fellowship in transfusion medicine in 2013.
Okay, thank you.
Yeah, I tried at various points during my pathology training to attempt the exam, but since there was only 3 of us in my year, we were very frequently assigned very busy rotations in pathology, which can be challenging at times.
Thank you.
Any other?
Let me just, Dr. O'Brien, thank you for appearing today. Do you know the total amount of years between 1 and 3?
I think that
It's 17 or 18.
I think it's 17. I think it's 17.
And have you applied to other states and been denied?
The only place I had started an application for and had an issue with was Alabama, where uh they had a 15-year rule for MD PhD, but there was a no time limit rule for MDs who were board certified like I am, and had active medical licenses, but the rule was not extended for MD PhDs. That is a state that I intend to appeal to, because we all complete the medical training similar to whether you're MD, MD PhD, MD, MPH, and so that's the only place that I have applied to that I had an issue with.
Thank you for answering those. I just wanted to make sure the executive committee had all of the information.
And again, I have had the active licenses in Missouri since 2013. I had a Massachusetts medical license, which I did let expire since I did not intend to go back to Massachusetts. Now I got that in 2013 and then let it expire at its expiration time period. Maryland, I've had an active license there since I think 2015. Florida since 2018, and then I just got the Louisiana license.
Any other questions?
don't have any questions.
If not, I'll entertain a motion.
I will move that we close this session and go into executive session to discuss.
Is
Second.
there a second?
Second.
So it's been moved and properly seconded, that we close the meeting to consider whether to go into executive session. Any further discussion on this issue? Okay, all in favor?
Aye.
Aye, and that's unanimous. So
Thank you very much for allowing me to present my case, and thank you for considering the waiver option for me for the medical license in Mississippi.
Dr. O'Brien, just wait with us. We're going to go discuss this. We'll be back.
Oh, okay. Thank you.
All right, we are back in open session and Dr. Joyner, our secretary, will share the results of or share the executive committee's decision.
Thank you, Dr. O'Brien. The board has decided to accept your request for a waiver, and congratulations.
Thank you very much. Thank you.
All right, thank you for taking the time to spend with us this morning. Good luck to you.
Thank you. May I leave the meeting now?
Yes.
Yes, ma'am, you may.
Thank you.
Okay. Moving on to the next item on the agenda, the appearance of a personal appearance by Dr. William Hillegas. Did I pronounce that correctly?
Yes.
Oh. Somebody-
Well, I'm Bill Hillegas. I'm requesting I'm going to get a Mississippi medical license to resume cardiology practice at UMMC. And I'm requesting a waiver of a clinical skills assessment for having been out of practice more than 3 years. I concluded my previous practice at UAB in Birmingham on December 31st, 2018, and joined UMMC January 1st, 2019. I've been here for 5 years in a kind of research, teaching, and administrative role where I've done a wide variety of biomedical research projects, including leadership of those projects at UMMC. When I first came here, I didn't necessarily intend to stop practicing, but at the time, the Associate Vice Chancellor for Research, Dr. Richard Summers, and the interim chair of data science, Robert Hester, who's a professor of physiology and the founder of HUMAT. He's a Guyton protege. They asked me if I would be willing to be full-time research, teaching, and administration. I took that back to my wife, who's an interventional cardiologist at UAB, and we thought about that and said yes, but I've sort of missed practice and the involvement, and have, kind of kept up with the cardiology department there, and meetings and conferences and research projects, and discussion with the chief of cardiology, who was supposed to be on the Zoom call, Michael McMullen. There is a need for more general cardiology help or labor, particularly when you're doing clinic. And so with that discussion, I said I would pursue getting a license to do that. So I graduated from medical school in 1988. So with a combined MPH degree in biostatistics, I've been doing biomedical research actually since high school through college and through my entire career, which was a combination of at Vanderbilt initially after finishing cardiology, interventional peripheral vascular fellowships at Duke. I was at Vanderbilt on faculty and practice there, plus, did research and teaching. And then briefly, my wife and I went to Evansville, Indiana in private practice and did a lot of research for 2 years. And then we were recruited to the University of Alabama at Birmingham. I was there from 2003, December 31st, 2018, practicing cardiology, particularly interventional cardiology, which there's about a minimum 60-hour-a-week job and usually a 100-hour-a-week job. It's a very busy, high-volume program. Kind of mid-course, 07 exactly, I think. I serendipitously invented a new statistical method. It turned out out of necessity in a research project. And that led me to referral to the biostats department there, and ended up pursuing a PhD. Just kind of echoing your first candidate, a PhD, while I tried to maintain full-time interventional practice at UAB during that time, which the first initial chief of cardiology facilitated that. And then he stepped down, there was an interim chair that wasn't too keen on that. And so I actually then became a independent contractor at UAB clinically and joined a private practice in Birmingham from 2011 through 2017, which actually corresponded with the time that my wife and I adopted 2 children. So it provided a little bit more sort of schedule flexibility. I also got some research grants that had effort requirements that were a bit of a problem for routine practice at UAB because they required during banker's hours that you be doing the research. And the private practice was willing to let me be kind of like a night and weekend and a holiday interventional cardiologist. It was a very busy practice. About a dozen cardiologists in Alabaster, Alabama at Shelby Baptist Medical Center. Plus they had a big referral volume of patients with peripheral vascular disease, which was one of my areas of specialty and intervention. So I maintained I had 5 board certifications at one point, but I was like the year or 2 after you were grandfathered in for life and you have to like retake every 10 years. I've let my internal medicine one go after 3 retakes. You know, I passed always, you know, at pretty high scores. I've maintained my general cardiology. My interventional cardiology has lapsed because, of course, this last 5 years, I haven't been doing procedures and don't plan to return to any kind of procedural role. Because, you know, personal belief, you've got to be a high volume kind of full-time person to like be good at that. And, you know, in my sort of age and career as well, it's something maybe best left generally to like younger interventional cardiologists to do. So, you know, that's basically it. So I'm requesting that waiver of the clinical skills assessment. I don't think I've lost anything in knowledge, or in some ways when you're in a research role, it's almost easier to like keep up with new things because of the, you know, the amount of information and time, you know, to keep up with the literature and guidelines, et cetera. The research projects. But that's it. And in addition to the knowledge and the skills, you know, I've changed practice enough times that I've done that you need a lot of local knowledge as well, like how the systems work, who are the people here, you know, what tests are available at our center, how does our EHR work. And so the plan that I've worked out and requested from Dr. McMullen, which is kindly granted, is that my first 50 clinic visits will be reviewed one by one by another cardiology faculty member, where I'll provide them a thumbnail sketch of, you know, what the cases and, you know, my decisions and plan with the patient to make sure I'm like, you know, up to speed, particularly with the UMMC practice environment. And then a quarterly review for the first 2 years back in practice.
Thanks, Dr. Hillegas. First, I guess, can you just reiterate, I was scribbling furiously while you were talking. Can you, again, give me your, so you've spoken with Dr. McMullen and you guys have come up with a kind of process. Can you just reiterate that process? Because I want to make sure I have it
So
clear.
the plan was this, that when I start, what I'm going to be doing is outpatient clinic, cardiology clinic, and the first 50 clinic visits on a weekly basis, I would review those one by one. Each visit, I'll create a thumbnail. You know, I saw 60-year-old male, and these were the issues, and this is the findings, and this was the decision process, and this is what I recommended. I'll review that with Dr. McMullen or another cardiology faculty member every one of the first 50 visits. And I kind of want that to make sure, I think that's the quickest way to get over the kind of local learning curve. Like, I'm not concerned about my medical knowledge or, ability to examine patients. But, there's a lot you need to know about your local practice setting to, practice efficiently and effectively and safely, I believe. And I thought that would be a good way. And then after that 50, if everything's like good and I think my learning curve's over, we would then go to a quarterly. I've requested a quarterly review of my practice with Dr. McMullen for the initial 2 years.
So as you talked about your plan for reintegration into this group, this is going to just be general cardiology. Can you explain to me what your role would be as a faculty member, like with respect to any supervisory roles that you may have, either with nurse practitioners, physician assistants, or with residents and fellows?
Yeah, so if there are residents or fellows in the clinic that I'm in, then I'm gonna, request to wait after that first 50, visits with their review process. Then I would supervise them in clinic as, I have at Vanderbilt and UAB for 25 years. And then, actually in both at UAB and in private practices, I worked with numerous physician assistants and nurse practitioners and cath labs. And I trained and supervised NPs and PAs, was cath lab staff, throughout my career. Mm-hmm. So I would conceive that may happen. But again, for the first 50 clinic visits, I would like to sort of do those sort of solo,
And so if I could say a few words, if that's all right, since I'm here to speak. I'm Mike McMullen, the cardiology chief at UMC that Dr. Hillegas keeps mentioning. And so, yes, our initial goals would be to put him in the outpatient clinic, let him work with patients, have close watch over that. Like you mentioned, for the first 50 patients, he would not be initially assigned any type of fellow activity, although he's been working closely with our fellows already on multiple research and QA projects, and it's been very beneficial from that standpoint. He wouldn't be overseeing a nurse practitioner either. That comes under my purview as well, and I would be reviewing these cases. I do appreciate your willingness to hear his request for the waiver. I have not worked clinically with Dr. Hillegas. He's trained at some of the best places in the country. He's worked at some of the best places in the country. But since I had not worked with him clinically, I did reach out to people who have spent many, many years of practicing him. He's had over 25 years of practice, and, they all raved about his clinical work and his patient interaction, using words like superlative. Dr. Chapman, who was a few years ahead of Dr. Hillegas at Duke, who was a few years ahead of me at Duke, recruited him to come to Vanderbilt with him because he was such an outstanding fellow. And then when Dr. Chapman went to UAB, he recruited Dr. Hillegas to follow him to UAB. So I said, that's probably the best compliment you can give somebody, not to hire them one time, but if you're going to hire them twice, that's a pretty good recommendation. And so I have no concerns. He's maintained his maintenance certification. He's been involved in all of our conferences and working with our fellows, and we will give him close oversight as he gets his feet back in the water. But I appreciate your support and discussion on his behalf.
So, Dr. McMullen, thank you for your comments. We were not aware, or at least I wasn't aware initially, that when this presentation started that you were with us. So I appreciate you for making your presence known. At this time, I would like to, however, allow the executive committee members to ask any questions that they have of Dr. Hillegas, and then if there are additional questions or follow-up questions that would come to you, then we can do those at that time.
What department do you work for now? Who employs you?
I'm have appointments in data science and in the Department of Medicine
Okay, so you haven't been in the Department of Cardiology at all.
for the cardiology, it's a
It's part of that.
section of medicine,
Yeah, I think they're a division.
division of
Yeah.
medicine.
Dr. McMullen, you said your initial goal was to look at his 50 cases and go over them with him. What down the road is your initial goal? I know he says that he's not going to do intervention, but is that something that's on the table for the years to come?
So I agree with him that interventional cardiology is for the young crowd. And so interventional cardiology, he hasn't maintained a certification. He hasn't been doing cases. That is not on the table for years to come. I do see him taking an active role in our outpatient service. And, after a year of review and going through these things, there, ideally would be the opportunity to have him on some of the inpatient services as well, depending on how the reviews go. And at that point, he would begin to have fellow interaction in the hospital.
All right.
Hi, Dr. Hilligus. Is this I'm a little confused. Is this an application, a new application for a medical license? Do you have a Mississippi license now?
No, I do not. It's a new application. I had an Alabama license for, 20 years and 2000 to 2019. And when I came here at UAB, I've been like half biostats and half interventional cardiology, which means like you work 120 hours a week. There's like no real half there, anything. And so when I came here, I was almost sort of burnt out from that dual role. And my wife and I, who's also an interventional cardiologist at UAB, we were sort of very time poor. And so we jointly decided, like, as requested by Dr. Summers and Dr. Hester, that I would just take a non-clinical role here.
So you did not need a medical license?
I didn't need one, which is why I let it lapse. And then, after you've been practicing, including, so my clinical training began in 1983. This is back in the days before, duty hours and all that kind of stuff, where, you're on call every other night as Al's officer at the Brigham. And after 35 years of intense clinical practice, practicing at pretty high-end interventional cardiology, programs, a couple of years into like stopping, I was sort of like regretting it because I just missed it. And, so I've kind of kept up with the chief of medicine, Dr. Butler, who left a few months ago and went to Baylor Scott and White, and Dr. McMullen and other clinicians, and just the research aspect of it just like hasn't really been
So have you?
satisfying enough.
Thank you.
And so because of that, it's a new application for a new license.
So have you submitted an application?
Oh, yeah. Yeah, and I wanted to thank, in particular, Ms. Boone. I've had like a long career, like 4 different places, and I really needed a lot of tips and hints of how to get these places to produce the required documents. It took about 100 hours of work on my part to like secure all the documents.
And then the 5-year, the 3-year rule for clinical practice came up when you submitted your application. Is that?
Yeah, I learned about that when I was learning about the license requirements.
Okay.
And, Ms. Moon said this is one of the requirements, but you could request a waiver.
Okay.
And so I produced a letter that lists the, basically all the areas of medicine that my research has touched in the past 5 years, and including very granular, like the topics in cardiology and, all kinds of things, breast cancer, even kind of sort of way out there stuff, like we've got studies of gun violence in Jackson, things that are sort of outside the medical pale, but, the research methods are applicable to. But anyway, I learned that there was this opportunity to request a waiver of the clinical skills assessment. I really feel like I've kind of lost nothing in my ability to take a history, do a physical, interact with patients. I would suppose, it's not on the table as mentioned, but, procedurally, I think if you don't keep doing that, you probably lose facileness, but, I'm not going back to that, but for general cardiology, I think that I haven't lost anything.
Thank you. Thank you.
Do you have an active license in any other state now?
I do not.
Yeah, and you haven't had since when?
My Alabama license I let expire in 2019.
2000.
Any other questions from the members of the executive committee for either Dr. McMillan or for Dr. Hillegas? Dr. Cleveland, any issues or
I'm
questions?
sorry.
Any questions?
I don't have any questions.
Okay. Hearing none,
I would like to move that we go into executive session or close this meeting. We consider going into executive session.
I second that.
any discussion? So it's been moved and properly seconded that we close the meeting to consider whether to go into executive session on this matter. All in favor? Aye. So that's unanimous. And then Dr. Joyner will share the executive committee's decision. Oh, wait, let's get it.
He's over here.
I just, I
The
guess,
decision's for you, Dr. Hilligas. You can accept it wherever you want.
you don't have to come back up, it's fine.
The executive committee has voted, that Dr. Hilligrass, Dr. McMullen, and Dr. Cleveland get together and work out a reentry program to be presented at the next board meeting in March of 2024.
So, the executive committee's decision was just that there needs to, just because of the length of time that you've been out of practice, there needs to be a more robust reentry program. This board actually we have precedents in this area and are willing to kind of work with you and Dr. McMullen in order to help structure that in ways that are similar to what we've done in the past in order to ensure a really smooth and safe transition both for you and for patients. And so hopefully you guys can get together. Dr. Cleveland is willing to provide some guidance and come up with a proposal that can then be presented to the executive committee at our next meeting and hopefully give us an opportunity to begin the process.
So do I email you then to get guidance on that?
We'll be in touch.
Oh, okay.
We'll
Thank
call you.
Okay. Thank you.
Dr. Hilligas, thank you so much for all that you've done, not just in the research realm, with our patients here, but also in your desire to kind of return to clinical practice, because we definitely have needs for cardiologists in this state. So best of luck to you.
Good, thank you.
All right.
Dr. Sherman.
Sure. Can you make a motion for our next appearance? Introducing some of the things that it will be. Like if you can. Okay, let me get it. Where are we? When I will be able to follow the first. One second. Moving on to the next item on our agenda, item 3. So pursuant to Mississippi Code 732561, we have a matter for review and discussion to be held in executive session due to the material being exempt from the Public Records Act. So at this time, I will entertain a motion.
I move that we close this session to enter into executive session.
I second the motion.
So it has been moved and properly seconded that we close the meeting to consider whether to enter into executive session.
Madam President, I'd like to invite the PHP, Dr. Floyd and Ms. Powell to come with us.
So invited.
Technically, you have to invite. I just recommend it.
Well, so I concur with the need for the invitation. We have a motion on the floor. All in favor? Aye. All right. All right, we are now back in open session and Dr. Joyner will give the decision of the executive committee.
Thank you. The executive committee in this matter has voted to approve the waiver and grant an unrestricted license.
So moving on to the next item on the agenda, we have a Zoom appearance by Dr. James Clay Hayes Jr.
Hi there.
Well, hello, Dr. Hayes. How are you?
Doing well. Thanks for allowing me to present to you, to such an illustrious board of friends.
Thank you so much for coming to hang out with us for a little bit of time today. We appreciate it.
Absolutely.
So tell us a little bit about why you're here.
My practice, Jackson Heart Clinic, is requesting a waiver for the 75-mile radius for oversight of the nurse practitioners. Actually, we have 5 different offices, and one office happens to be in Louisville, where I actually am today. And so, as many of y'all know, it's become a very busy time, particularly in the Delta, with the lack of cardiology services. I heard from the speaker, I guess 2 speakers ago, about the need of cardiology practices. And so we've really gotten busy, particularly with a lot of cardiologists leaving this area. We have had an office in Louisville. Dr. Hutchison was manning this clinic for 10 years, and then he retired approximately 2 years ago. And 6 of us have been coming up here every week now. And we continue to try to meet the needs of the community up here. And we come up here every Monday and Wednesday. And one of the challenges we face is we also have busy practices in Jackson and Madison and Flowood and Brookhaven. And so we see a lot of follow-up patients here in Louisville. And we were hopeful that we could enlist the help of one of our very capable nurse practitioners, Mandy Berry, who's also on the Zoom call with me, to help us see some of the follow-ups. Like, for example, today in Louisville, I saw a patient that had congestive heart failure, and we started her on medication, and she's going to need a 2 to 3 week follow-up for her blood pressure and a lab work and that sort of thing. Or if I see a patient that has a procedure in Jackson, that we typically like to see the patients, our protocol is to have them see somebody in the office within 1 week to make sure they're doing okay and have, their medicines and making sure they get all the things that they need. And it's lowered their readmission rate. So this is one of the reasons why we like to do that. And so that's our story.
All right, anybody have any questions? Ms. Berry, how long have you worked with Jackson Heart Clinic? You're muted.
Here we go.
That's okay.
Yeah. I've been with Jackson Heart since 2016.
And so the proposed functions that you will be performing or the services that you'll be providing, are they much different from what you are doing currently at Jackson Heart right now?
I have been serving in the clinic aspect as well as in the hospital, but from a clinic standpoint, it will be this exact thing.
And so since 2016, so at least 7 going on 8 years of service in that practice. Okay.
Yes, ma'am.
Any other questions?
This is Louisville and not Indianola. I think somewhere in my mind I got Indianola.
Yeah, we go through Indianola to get to Louisville, but Indianola obviously is about 20 miles. So we have a clinic. It's in a clinic right outside North Sunflower Hospital. I mean, we could walk across the yard here to the hospital over there.
Yeah, I grew up in Greenwood, so all that's home.
There you go.
I guess
And is this gonna be fully staffed 5 days? Are you doing 5 days or is it just gonna be those 2 days?
Just the 2 days, so Mondays and Wednesdays. And so we're still, like I'm still coming to Louisville. It's just because to see the new patients and that sort of thing, our practice has been that the nurse practitioners see the follow-ups and we see all the new patients. I mean, we still see follow-ups too, but that's what we need help with.
Yeah, and Dr. Hayes, so this request is specific to the Rouville location.
That's right. It's because it's, outside the 75-mile radius from Jackson.
Any other questions? If there are no other questions, then I will entertain a motion.
Move that we adjourn this session, go into executive session to consider this request.
I second the motion.
So it has been moved and seconded that we close the meeting and to consider whether to go into executive session on this matter. All in favor? Aye.
Well, hey, y'all give us a few minutes and we'll be right back with you.
Of course. Yeah. Take your time.
All right, we are back in open session and Dr. Joyner will give the executive committee's decision.
Thank you. The board moves to approve the waiver.
Thank you both so much for being with us.
Thank you. That's great news. We really appreciate all your help and y'all have a great day.
Now, we appreciate what you guys are doing up there for a population that has a significant need. Thank you.
Thank you. See ya.
Bye. So at this point, I'm gonna turn the meeting over to Dr. Lippincott. You don't get the gavel though, but I'm giving you the meeting.
I'm Ken Lippincott, Vice President, filling in for Dr. Owens, who has recused herself. And we have Dr. Kirk Kennard on Zoom to fill in here on the executive committee. And the next item on the agenda is a request for a waiver from Dr. Michelle Owens.
Yes, so good afternoon, everyone. I'm Michelle Owens, and I am a maternal fetal medicine specialist and obstetrician gynecologist by training. And my request is for an organization called Converge Partners in Health. Converge is an organization that I started working with I've been a part of that organization since its inception, working first as a community advisory board member, and then transitioning to part of their staff as the medical director. And then as the organization has grown and received the Title X funding for the state of Mississippi, was asked to work with them as the collaborating physician. And initially, it was more of an organizational supervisory role that focused more on education and training of some of the centers that received Title X funding across the state of Mississippi, or at least who participated in Title X type activities. And it has now since kind of morphed because of need and because of just a limited number of individuals providing the Title X services and being able to check off all the boxes that are required for Title X funding, to provide some clinical care to kind of fill in the gaps. So in this role, what I'm asking for is a waiver. The organization has hired nurse practitioners and are becoming involved in the process of providing telehealth and also some pop-up clinics for basic women's health type services. The telehealth services are more related to STI, some contraceptive care, and also maybe urinary tract infections or minor urogenital complaints. And so I've been asked to serve in that capacity. Initially, when I was first a part of this organization, I was employed by the University of Mississippi Medical Center. Since that time, I'm no longer with the university and have still continued on with Converge and some of my other work at the State Department of Health, but am primarily engaged in clinical care outside of the state of Mississippi. I still very much consider myself a Mississippi physician, and I'm also looking to continue practice within the state of Mississippi. And so I'm asking for this waiver to be able to continue to work with this group. These nurse practitioners that were hired by the organization were vetted by me, in addition to the leadership of Converge. And so they're all either women's health nurse practitioners or family nurse practitioners and have some either direct clinical care related to women's health or have a demonstrated passion for women's health and the patients that we serve through the Title X programs. And so with that, I think the information that I provided includes our protocols as well as information on the individuals. And so I'm at this point open for any questions that you may have.
Thank you, Dr. Owens. I'm a little confused. Are you asking for a waiver for your collaboration with the nurse practitioners at Converge?
Yes,
And that's here in Mississippi.
that is correct.
But the exception is that because, could you tell us about your primary practice? Is that listed in your application in Indiana?
That is correct.
Could you explain that?
So I work for Ascension Health, which provides consultative maternal fetal medicine services. It's a regional perinatal center, a level 4 perinatal center. That involves me having the opportunity to be in person and provide services both in the hospital and in the clinic. And also because of our robust telehealth system, the opportunity to do it virtually as well. So that is where I'm doing the bulk of my maternal fetal medicine practice work. And so it's the waiver request is for the 20 hours a week for working in Mississippi in clinical care. And I think we've included that, I think the 80-mile is also in effect just because my practice is not 80 miles away. But I fully intend during those times to be here and be present.
Okay, and the nurse practitioners you're collaborating with Converge, will you be working with them face to face?
So as it stands right now, initially the rollout, it's a 2-phase care rollout plan. We are initially starting with telehealth. Okay, so those initial encounters will be through telehealth services. And then it has been mentioned, but we don't have a formal plan in place right now for pop-up clinics. During the first year of the Title X funding, we did we actually went through and did some audits of those locations and sites. And during that audit process have also kind of been able to identify some gaps in care, both spatially and with respect to just geographically. And so the goal would be at some point to potentially offer pop-up clinics for some of those places that have demonstrated need. There has been an attempt at collaborating with the State Department of Health in order to kind of work with them in partnership to try to help bridge some of those gaps. And Dr. Edney, who you know is our state health officer, has been very receptive to the idea of trying to meet those women's health needs. But as the State Department of Health is not really fully engaged in active clinical women's health service care at this time, until that process is up and running, that's just something that we know will be coming in the future. And I will be very transparent, I don't have a timeline for that because that's not really where we're focusing efforts and energies at this time.
And you share an electronic health record with these nurse practitioners?
So yes, so we will share an electronic health record. Athena is the chosen health record that we will use.
Okay. Any other questions from Dr. Joyner or Dr. Kennard?
Not really. This clinic is going to be located on Pear Orchard. Did I read that?
So Pear Orchard is where Converge is centered right now. So that is the only physical location that exists.
And you plan on expanding to the state?
So right now, Converge it's a statewide organization that is centered at Pear Orchard. Okay, so that would be headquarters or the location. The pop-up clinics, as I said, are kind of to be determined and would happen at various places across the state. My goal and what we have discussed is more related to things like pap smear screening in some of these lower resourced areas where people have difficulty with access. And being able to kind of work with our nurse practitioners to train them and get them to a place where we will be able to offer those services as an accentuation of the breast and cancer program that's up and running in the health department to be able to offset some of that for people who are in some of these maternal health deserts.
Any other questions? Well, thank you for that information, Dr. Owens. Do we have a motion?
I have a motion, we go into executive session. Oh, I have a motion, we close. I do this every time. We close this session to go into executive session.
We have a motion to close the meeting to consider whether to go into executive session. All in favor, say aye.
I'll be the second.
Second, okay, all in favor, say aye.
Aye.
Kirk, I'll call you on my cell phone for your text.
Okay. Okay.
The executive committee is now back in open session, and I will ask the board secretary to report on the board's action.
Thank you, Dr. Lippincott. The board voted to approve the waiver.
Thank you. And if there's,
She takes back over now.
I will defer to our president, who's back in the seat.
All right. Okie dokie. We'd like to hear from, last item on the agenda, last but certainly not least, we'd like to hear a little update of all of the wonderful workings of the executive director.
Absolutely. So this is my November, December report, right? So just to remind y'all, I meet monthly with the other healthcare boards, Department of Health, pharmacy, nursing, and dental. Meet monthly with our PHP friends. This in November, December, I had regulatory compliance meeting with 3 different licensees. We had an OLRC meeting on 12/19, at which the OLRC approved the repeal of the bariatric rule 1.6 and approved the new definition of prescriptive authority. We've been working with the Board of Pharmacy. This is a complicated issue relating to FDA regulations, and it's FDA regulations 790, 795, and 800 that deal with the mixing of drugs and compounding. And although it's this is mostly done in pharmacies, there are medical practices that do this as well. Your most obvious example would be like an oncologic practice. And so we have been trying to learn what the reality of the situation is by visiting different oncology practices and advising them on how to get in compliance with 790, 95, 795, and 800. I've had meetings with a ambulatory surgery center and their attorney about the collaboration between the CRNA and the anesthesiologist. Additionally, met with the Department of Anesthesia Chairman, Dr. Aurora, to discuss collaboration between anesthesiologists and CRNAs. I've been, as y'all know, the legislative session has begun. I began actually prior to November to start meeting with different legislatures to discuss the Medical Practice Act and the changes we would like to see in the Medical Practice Act. So that continues and will continue for the next several months. I don't know if everybody noticed, but I thought I would just bring up that we did have an article published in the Journal of Medical Regulation, which is produced by FSMB, about our changes to the initial application licensure as well as renewal application with the attestation statement, something we've actually gained national attention for. And then in follow-up to that article, I was interviewed for a podcast, which has also been put online and is available to the public. And so
Could you send us the link?
I can't. Well, you know what? We'll try to make that public. Maybe put it on the website. Ken?
Yes.
Okay. We'll do that.
Thank you.
All right. Any other questions? That concludes my part of the report, unless y'all have other questions.
No, thanks for all your hard work. We appreciate it.
Thank you.
Appreciate you. Go Blue.
Thanks, Ken. Rest of the board. I'll see y'all at the next one. If I'm not needed tomorrow, my ortho appointment's 12:30. So if there's an urgent need for me to join for a quorum purpose around that, I'm glad to. If not, just let me know if you need anything else.
I hope it all works out. Thanks so much, Kurt, for your service.
Yeah. Good to see y'all.
All righty, bye-bye.
Okay, bye.
So motion to adjourn. The
So
executive
moved.
committee meeting.
Do we need I'm making a motion that we adjourn.
Okay.
So, all righty. Look, meeting stands adjourned.